Welcome back to the OrMobility podcast, where we cut through the noise and give you clear, practical strategies for movement, strength, and health. I'm Dr. Garrett Stroup. I'm a doctor of physical therapy and a movement coach. Today's episode is going to be a big one because chances are you or someone you know deals with jaw pain, neck tension, or upper back stiffness. Whether you're a health conscious individual, a rehab professional, or an athlete, this one's for you. So we're going to break down how your jaw or your TMJ, your neck, and or your upper back, how they're all connected and what dysfunction really looks like and how to finally stop chasing symptoms. We're going to bust through some myths, walk through our clinical model of recovery, and share red flags that you cannot ignore. So let's jump in. So the TMJ, it's more than just your jaw. The temporomandibular joint, or the TMJ, is one of the most powerful and sensitive joints in your body. It allows you to chew, talk, breathe, and hopefully not grind your teeth at night. Movements of the TMJ include depression, which is opening your mouth, elevation, which is closing your mouth, and lateral deviation, which is moving your jaw side to side. The key muscles include your masseters, your temporalis, and your medial and lateral pterygoids that are more within your mouth. So what goes wrong? Common TMJ dysfunctions include clicking, popping when opening your mouth, jaw or temple pain, headaches, trouble chewing or yawning. And a common myth to bust for the TMJ is everyone has a TMJ. A lot of times I hear people say, "Oh, my problem is TMJ." No, it's not TMJ. It's you have a TMJ dysfunction or a TMJ disorder or TMJ pain. And the difference matters because your language shapes your treatment. Common contributors for the TMJ dysfunction often includes poor cervical posture because if your head is forward, then your jaw is falling into gravity, making your muscles have to overwork. Also, a lazy tongue. A lazy tongue posture can strongly influence how little or how much your jaw has to work. Poor chewing mechanics can also wear away at your joint and your disc and cause irritable disc type situations like lockjaw. And also, a big problem is ignoring the power of movement to reduce tightness. A lot of times I hear people worry about their jaw and they speak in frames of mind like mileage. Like, oh, if I move my jaw too much, I'm going to irritate it. Yes, I mean, if you're constantly chewing gum, that can be an issue. But if you're worried about moving your jaw at all, you might run into very similar issues as far as overusing your jaw. And here is the clinical kicker. TMJ pain is often not just a jaw issue. It can involve the disc in your jaw, the disc in your cervical spine, or muscles in your neck and mid-back that can all refer to the TMJ. That's why a proper assessment is critical. So now let's dive into the cervical spine, the neck that never rests. The cervical spine is your body's lookout tower. It orients you to the world. It protects your nervous system and guards your airway and blood supply to your brain. Now, the neck is broken up into two components, the upper cervical spine and the lower cervical spine. So the upper cervical spine is usually considered C1 and C2 because this is where most of your rotation in your head occurs, about half of it actually. The other half is involved with your lower cervical spine. Generally, our lower cervical spine is from C3 to C7, and that handles a lot more of your flexion, extension, and your side bending. But here's a surprise. Full neck movement involves your thoracic spine and your ribs, all the way down to T6 and your initial six ribs in your mid-back. And so essentially, even in full neck movement, it requires your mid-back too. And the key muscles to include are your sternocleidomastoid, your upper traps, your levator scaps, your scalenes, And then there's a few other muscles, but those are the big ticket muscles. Common causes for these dysfunctions include a forward head posture, poor sleeping positions, holding stress in your neck, poor overhead movements or overuse in your sports, and weak muscles. What I always like to explain is weak muscles are tight muscles, and tight muscles are weak muscles. So we might need to stretch, but we also might need to strengthen. Now, a myth to bust is more range of motion is better. Actually, excessive upper cervical mobility can lead to a lack of lower cervical mobility, and that is a very root issue for many people. So many people are trying to get more motion out of their upper neck, and they're not pushing the responsibility to their lower neck. And that's where most of the work that I find to be done is necessary. Furthermore, your neck mobility doesn't stop at C7. It actually involves every thoracic vertebra, specifically down to T6, about halfway down. But if you really get a feel on all the thoracic vertebra, they're all necessary. And then as far as a bonus aspect to the neck tightness that you might be experiencing can cause dizziness. Yes, that is called cervicogenic dizziness. Cervicogenic dizziness. And it's a real condition that's tied to instability and or over tightness at the neck and or poor control of the cervical spine. The biggest pattern we see is a stiff lower cervical spine and an overly mobile upper cervical spine and very weak thoracic muscles and a very tight thoracic spine. Okay, so let's get to section 3, the thoracic spine. This is always what I like to explain as the forgotten middle child. The thoracic spine involves 12 vertebrae, 24 ribs, and over 127 joints. And it's often ignored, but it is the base of your neck and the foundations for your shoulders. The key movements include rotation, extension, flexion, and side bending. The key muscles include your paraspinals, like your erector spinae, which include your spinalis, your longissimus, and your iliocostalis, your rhomboids, and serratus anterior, and then your intercostals, which are the muscles between your ribs. Now, what causes dysfunction here? Hours of sitting with poor posture because you're putting too much work on the muscles in the back and they will tighten up because if they're tight, remember they're either overworked or they're not strong enough to do what you want them to do, which leads to the second problem, which is that weak mid-back. Restricted rib motions are very common. Poor shoulder blade mechanics, breathing dysfunctions, excessive rotation in your sports or trauma, and osteoporosis. Now, the big myth to bust here is tightness means you need to stretch it out. Not always. Often tightness means that you feel your body asking for more stability, not more mobility. Stretching alone doesn't fix weakness or poor control. Clinically, the thoracic spine is often the missing link involved in solving neck problems, shoulder problems, and even your jaw pain. Now, at the neck, this is where we want to look at a lot of red flags and when we want to know when to refer out. Now, let's be clear, not every ache a foam roller problem. Some symptoms require immediate referrals to your physician. And here are some of those red flags. Neurological signs, severe weakness, numbness, and or tingling to the arms, legs, specifically when it's symmetrical. When it's symmetrical, sometimes you could have two nerve issues going to both arms or both legs, but often we want to make sure that it's not one issue impinging upon the spinal cord. Another neurological sign we want to look at is visual changes like shuttered vision, spots in your vision, and black spots in your vision, slurred speech, and facial numbness. Other aspects we want to look at are upper cervical instabilities. We want to look at this if we hear that you had a car accident, a trauma, an assault. Another sign of upper cervical instability can be more of like a bobblehead feeling, severe motion limitations, like we can't even move our neck, requiring often like a C collar, and trouble swallowing or a sensation of a lump behind your throat. Another upper cervical problem we want to look at is vertebrobasilar artery insufficiency or VBI. And this can happen when you feel dizziness when looking up and kind of extending and bending to one side of your neck. That often includes what's called a drop attack, which is just a fall to the ground when you look up. So it's like, hey, I looked up at the sun and then I fell to the ground and I don't even know what happened. Blurred vision or tunnel vision is another sign of a red flag, and difficulty swallowing and speaking. What we'll also want to look at is, are you experiencing fever, chills, or a recent infection? And severe night pain that you're not feeling during the day, but you're waking up at 1 or 2 in the morning with severe night pain. Systemic red flags often include unexplained weight loss, history of cancer, and non-positional, unrelenting pain. Another aspect that we want to look at is signs of a fracture or structural lesion, like severe post-trauma pain, swelling, deformity, or crepitus, like crunchiness, severe crunchiness. If these do show up, it's not time for stretches or more massage. Oftentimes it's a sign that we want to do a referral and more imaging is necessary. The OrMobility clinical model involves looking at your posture, range of motion, strength, control, and function after we make sure you're not dealing with these red flags. So let's wrap it up and look at the framework that we use in OrMobility. Again, posture. We don't need perfect posture, but we need a sustainable and adaptable posture, meaning we might not be in perfect posture all the time, but we want to know when we're stepping outside of that good posture. The next aspect is range of motion, enough to support the movement that you need. Again, excessive mobility is not better. I work with a lot of people who have overmobilities, and it has its trickiness in its own way. They have too many options to move. And what we really need to figure out is, what is the optimal amount of range of motion? And that's not actually that individual. We generally find for people, when it comes to cervical range of motion, you want 80 degrees. You don't want 100 degrees. That's too much. You don't want 50 degrees. That's too little. Side bending. You want 45 degrees. You don't want 80. We're not owls here. We need to have a certain amount of range of motion, but any more can lead to severe other issues like blood vessels being impinged upon, nerves being overstretched, or discs being overly irritated. More range of motion is not better. Optimal range of motion is key. The next aspect, range of motion allows you to move, but you need the strength to be able to protect that range of motion. It's not helpful if I can side bend my neck, but I can't bring my head back up. And then the fourth aspect to this is control. We want to be able to control our muscles, but if we're overly shaky or we're not smooth with our range of motion, there's going to be overstrained muscle fibers that can become very sore. We really want to make sure we're in good control. The next aspect is function. Function's what's really meaningful. You can have good range of motion, you can have good strength, but if you can't go for that walk or you can't lift that box overhead, that's what we're really looking for out of this. This is real life movement without hesitation, pain, or fear. This is the model we like to use, whether we're treating TMJ disorders, cervical pain, thoracic dysfunction, and it's about building systems, not chasing systems. So that's it for today's episode at the OrMobility Podcast. If you learned something now or realize that you've been chasing the wrong culprit, share this on the episode in a comment below, or feel free to reach out to us. And if you're here in the Roseburg area, please give us a call here at OrMobility. We're here to help you to move well, stay strong, and live fully. Head to spine and everything in between is where we want to help you. Thanks for listening. Again, I'm Dr. Garrett Stroup, your physical therapist, and we'll see you here next time.